Hey, so Dr. Lindsey here. We are 5 days out from a mini facelift on a patient I worked on 10 years ago. And I asked her if she would just make a couple of comments. First of all, how old are you?
62.
And you're really healthy and active.
Yes.
And so I worked on you in 2007, did a little mini lift.
Yep, exactly 10 years and 1 month ago.
And was I honest with you back then? And
brutally honest, yes.
Okay. And how much did it hurt you 10 years ago?
You know, it was not comfortable, but it was a lot easier this time around.
Okay. So I saw you again a month or two ago, and again, the thing you have going for you, you've got such great skin, and you got a good husband, which
Yes.
Makes you age less than a lot of people do.
Yeah, and I'm active.
And so last Friday, we did a little mini lift. I gave you a little Valium, and I numbed you up, and the numbing up hurts a little bit, right?
Yep.
And then we did the procedure, and you went home, and then the next morning I saw you.
Right.
And you told me, how much pain did you have that first night?
I only took 3 pain pills. I woke up at 3 a.m. I took the Vicodin twice, two or three times, and I woke up at 3 a.m. in pain, and I took a Tylenol because I didn't want to get nauseous.
Okay.
And Tylenol worked just fine.
And the biggest pain in the neck is wearing that head wrap, right?
Yes.
Yeah.
It itches.
Okay. And so you're 5 days out. We took your stitches out a day early just because you're healing so well. And so you're going to use some vitamin E for the next month or two, and hopefully we'll get you back and get an update on this video and some updated pictures.
I'm still very swollen, so I'm going to come back in a week or two.
Okay. All right. Anything you want to tell the public?
Dr. Lindsey is a sculptor. He does a great job. It lasted almost 10 years, the first one, and this one he did a little bit more work on me because I'm older. So I fully expect a great result for the next 10 years. So I don't know if I'll be back in 10 years. That might be my last one, but we'll see.
Okay. Well, thanks for your talk.
Thank you.
So, refresh my memory. I worked with you maybe 10 or 12 years ago.
10 years ago, exactly. Well, yeah, 10 years and 4 months.
And we did a little lift, and then you
Mini
did
lift.
fine.
Mm-hmm.
And you're how old now?
62, almost 63.
So, in the margins of this video, I'll put up your before pictures.
Okay.
And so we did a little lift on you in May of this year, is that correct?
April.
Mm-hmm. And now it is September the 15th, so you're about 5 months out.
Mm-hmm.
How has it been?
Great. It was much easier the second time around. I don't know why, but even though you did more work, he did more under here, but it was fine.
And how much did I hurt you when I did it?
Not at all.
Okay, we did it with you awake with this
Wide
little
awake.
Valium.
We were teasing him the whole time.
We like to do that.
Little
And you've got short hair.
Yep.
And the pain in the butt of this whole thing is you got to wear a head wrap for a week and then sleep in it for another
that didn't
week.
bother me. It actually felt good.
Okay.
But yeah, no pain.
And your husband was supportive of all this,
Oh
right?
yeah.
All right.
Oh yeah.
Turn just a bit that way, and so you wear short hair,
Yeah.
and your scars, let me put my glasses down, are pretty typical at 4.5 or 5 months out from doing it, and still numb and all?
It's coming back actually. I just noticed. Yeah, it's back.
So second time in your face takes a little longer, and you got a nice pointy chin, and I think you look fantastic. You look refreshed.
Yes, I do. I don't look pulled and tightened, and people don't realize I've had it. But I tell everybody anyway. So my good friends.
So one of the issues is that with a little lift, you have to be careful to give the customer enough to make it worth doing, without pulling so much that they look windswept. And I'm not a big guy into that windswept pull.
That's why I like you.
Part of going for you is you've got good skin.
Yes.
And part of it is that you look refreshed.
Yes.
Right?
Yes.
Any advice you want to give anybody?
Do it. Oh my gosh, I do it every 10 years, but I don't know that I'll do it when I'm 72. We'll see.
All right. Okay. Well, thanks.